Hi everybody, even the cutlery has stopped moving. I'm hoping there's some slides, but there's nothing there, so hey. Thank you very much, and sorry for disturbing your lunch. Please carry on. I can up my volume if we need to cover things. I was going to ask some questions, thinking I'd need to keep you awake, but who here lives in an urban environment? Stick your hands up. Great. Who here is a parent of children? Who here is a female parent of children? Few hands, mainly. Great. Fabulous. Who here travels around London? Right, it's relevant to all of you. The rest of you can just eat quietly, if that's all right. I don't know who I tell to have my next slide or what I do. Oh, I've got a button. How fabulous. Thank you. Let's see what happens. Do I point this at something? Hey, okay. I had my first lesson that women are activists in public health a long time before I entered public health. I had my first lesson in the Hindu temple in Slough when I was 12. I was there on a trip with the Girl Guide pack that I belonged to, and we were chatting away to this great bunch of women, learning all about the temple and their culture and what they did. And I asked the crazy question, where are the men? And the answer was, they're over in the corner talking about international affairs and what's in the newspapers. And I said, well, don't you want to go and talk to them about, important things like that? And they said, important? No, we're talking about really important things. We're talking about what they're going to eat tonight for dinner. We're talking about who their daughters are going to marry. We're talking about who keeps their community going. And I thought that was a really interesting lesson on the nature of power and perception of power, and also the role of women in our society. And I think what I'd like to talk about is what the Mayor's office does. But through all of it, I see women as key activists in making it happen, because our experience is that when we do things with communities, when we try and improve health, it's always women who are at the front of the queue trying to make that better. So, this is not a man. I presume you'll all recognise the fair locks of the Mayor of London. And he has an unusual role. For the New Yorkers here, he does not have the same role as Mayor Bloomberg. He doesn't nearly have as many statutory powers. He doesn't run the health service in London in any way at all. But as we all know, he has huge visibility. Everybody knows who this man is. If he sneezes, it's on the front page of the Evening Standard. It gets into the national press. He can convene conversations, convene discussions, and highlight issues. And although that isn't a statutory power, it's a very, very influential power, and one that we try and use a lot in the work of my team. While we don't have huge amounts of funding, we don't have many statutory duties at all, we have him to help us to raise the profile of issues. So what does the average Mrs. London want? Well, for a start, we all know that London is a hugely diverse city, and there isn't a Mrs. Average at all. I scrolled through Google Images looking for a cartoon of women and couldn't find anything that was at all representative of London's women. So I'm afraid you've got this. It's terribly politically incorrect, I suspect. But I would vouch that whichever woman you pick in London, she is the one in her family unit, in her community, who's the one who worries about what's in the packed lunch for the people who go to work and when they go to school. She's the one who worries about whether people in her family unit are getting enough physical exercise, whether they're healthy. She's the one who worries about the nature of the community in which they're growing up, and does most of the organising of the social life and organising of the communities around her. And so this is why they are the activists they are. And what I'm going to do now is quickly scroll through a number of initiatives that the Mayor's office is taking that show how we are answering those concerns of the women at a very local level. Let's hope it goes on to the next one. Try again. Here we go. Right, St. Peter's London Docks Primary School. This is dinner time. It's not quite as grand as here, but a bit more colourful maybe. St. Peter's London Docks is one of our healthy schools. I'll tell you a bit about the Healthy School Initiative. But they have made food a central part of how the school works. They realised that the kids were wasting their lunch times queuing up, And by the time they got to the food, it was cold, they didn't like it, therefore they were bringing in packed lunches, and they were skiving off school, and all this sort of thing. So they changed the dining room. They made it all red and spotty. They got the kids to sit down at tables. The kids served themselves highly nutritious food that fits within the nutritional guidelines of the Children's Food Trust, which is a national body here that sets nutritional standards for school food. And they serve each other, and they learn the art of eating and conversation and the importance of meal times. And it has transformed not only the lunch times of the school, but the community feel of the school. They were one of our very early healthy schools in London. The Healthy Schools programme was a national programme that was stopped when this government came into being. But there was still a huge amount of enthusiasm for it in London. 98% of London schools were healthy schools in the old model. And so we managed to, by hook or by crook, find some funny money, as one does, to relaunch the Healthy Schools programme for London. And we Londonised it. We launched it last April. We're aiming to get 300 schools signed up by October, and we now have 290. We're aiming to get all 3,000 schools signed up by March 16, when our funny money runs out, on the hope that we find some more funny money. But what we do is, as part of that, is set nutritional standards. If you want to be a healthy school in London, you have to abide by the set of nationally agreed nutritional guidelines. And you need to put forward plans about how you're going to make the food and the drink offer in your school a healthy and nutritious offer. And the other element, most of this is predicated around obesity, by the way. So at the moment, it's very much focused on physical activity and food. This is another of our healthy schools, Norwood Green Junior, who he noticed that at playtime, all their kids just all stood around yakking, and they wanted to get them moving. So they did something really high-tech and really complicated. They painted hopscotch on the playground. And it doesn't take much, and they've taught a couple of the kids how to be play facilitators, and at lunchtimes now the kids run around just because they're there. Kids do that sort of thing. It wasn't anything high-tech, it just took someone to sit there and think about what can we do. And so these are the ideas that the Healthy Schools programme is there to promulgate across London, to try and get other schools to follow that. And we have partners in each of the boroughs who work with us to spread the good news and to network with the schools and get the schools all thinking together and with each other. And so simple things can make a huge difference. The schools programme is a voluntary programme. There's no compunction, there's no compulsion for the schools to join. But really, to a certain extent, it's the schools that have driven the continuation of the programme. And every year we have an awards ceremony, and they get given a certificate with Boris's signature on it, and the Deputy Mayor does her bit. And last time at the launch, we were all drawn to tears, and we had the ladies captain of the English football, the Great British Olympic football team, telling us about how important her school was to her future, and the fact that she had ended up being the captain of the England football team because of her school. A very emotive event, but we'll do that every year and to try and keep the momentum going. I asked us how many people travel around London. We all travel around London, and the mayor is the person who runs Transport for London, so this is the mayor's responsibility. Nice picture of him on his own Boris bike down there. What we do know is that the people of London are generally not physically active enough. We do know that there is a subset of those people who are physically active enough, and the vast majority of those people are physically active enough, not because they don't lycra and kick footballs around and do sporty things, but because they cycle and they walk around the city. They use active travel means to get there. So we need to increase the amount of walking and cycling in this city. We need to do that because there are too many cars, and the tube, I was anyone being on the Northern Line at peak time is just foul. So there are very good logistical reasons why cycling and walking would be a good idea, but also because it will save lives. We've done some great modelling that indicates that if you look at every journey that's done not by walking and cycling, that could be done by walking and cycling. So they're short journeys, they're not during rainy days, they're not when people are carrying heavy things around. If you turn those journeys that could be into walking and cycling, we would save the city, I've got the figure because I can never quite believe it, £2 billion a year, and we would save 60,000 life years every single year just by getting people more physically active. And it's very easy to walk a couple of tube stops rather than get on the tube. It's an eminently walkable, cyclable city. It's dead flat. So I have got a public health specialist embedded in TfL who is obsessed by active transport. She's actually on a self-funded study tour of America at this moment, talking to transport officers in her own annual leave. But there you go, that's how obsessed she is. But she is working with Transport for London to get them thinking about all the things that they can use, the science behind who they should try and communicate with about this, what they should do to the road markings, to the street environment, how they should get the message out there, all the behaviour change skills that in public health we have, so that we can begin to really implement the changes in the cycling strategy, really implement the changes in the risk strategy. And I have to counter what was said this morning about cycling being risky. The figures show us that it's more dangerous to walk in London than to cycle, and actually it's more dangerous to go to drive in France than it is to cycle in London. So cycling in London is not that dangerous. I know people die, but very, very few do die. So please get out there and try your Boris bikes after lunch. Another thing that Mrs. Average Londoner worries about is what happens when she and her partner are at work and whether they are, again, encouraged to be healthy. We have another charter, we have another awards system called the Healthy Workplace Charter, and these are the logos of all the companies who are currently signed up to our charter, which we only launched last November, and we're aiming to double that this year. A whole range of organisations, from private organisations through the NHS, through universities, through boroughs, who have taken on board a framework which is evidence-based, is based on some national work done by the Department of Work and Pensions, for how you can make small changes in the workplace to improve the health-enhancing elements of that workplace. And we're talking about things like having smoking cessation groups in the workplace so people can go in their lunchtime, about having easy access to exercise, maybe an arrangement with a local gym, or encouraging people to walk rather than take the tube when they go to their meetings, having fruit bowls. It's really small things, but we estimate there is a return on investment of £9. So for every pound that any of these employers spends, they'll get £9 back. How is that? That's because the staff feel valued, they don't leave so often, the staff turnover reduces, and also because they take fewer sick days. And so there is a real economic argument why this is a good thing to do. And we hope that by recognising that, by giving these people the recognition, we will encourage more and more employers to create health-enhancing workplaces. This is Well London, and Well London's another programme that is run from my team. It's funded by the Big Lottery and has been going for about 5 or 6 years, and we've had in all about £12 million funding from Big Lottery. And it works in the poorest parts of London, in small estates, to populations of 2,000 people, very, very ground level stuff, and goes in and asks them what would they like to see that would make their populations more healthy. And they don't come back with the answer saying another hospital and a shiny new GP surgery. They come back saying, we don't want to be so lonely. We want a community that works. We want to be able to eat healthily. We want to grow our own food. We want to be able to be more physically active. Really simple, basic things, which I know are evidence-based. They don't know that. They just instinctively know that's the right thing to do. And we've been working in these communities and making huge transformations. I visited one last week where they used to have a huge waiting list of people trying to leave this particular housing estate because it was so grotty. And the Well London programme has been running there for about 2 or 3 years, and they now, people take themselves off the transfer list, and people are trying to get into this estate. It has completely transformed the estate. Because they now know each other. It's built up relationships. You have cooking clubs sharing all the various different types of international cooking that goes on. You have intergenerational workshops where the older people teach the younger people. Whole range of opportunities to eat well, to move more, and to build community. And this has been a huge boon to what we do. We're just hoping that we can get more funding again. Big lottery is great, but what we need to do is mainstream this. And we do have a couple of boroughs now who are recognising the value of this and who are funding their own programmes using this model. We also have a full evaluation being done by the University of East of London, one of the big partners in this. That will be published later on in the autumn, showing that this improves measurable things around mental health, physical activity. It's very exciting work. It's not glamorous, but it's very effective. Earlier this year, the Mayor ran an international conference called Fit Cities, Fit World, similar title, a 2-day international conference looking at urban planning and how design and urban design can improve health, how it can increase physical activity, increase mental well-being. Everyone knows exposure to green spaces improves mental well-being, and also just improve community, which again improves the physical activity and the mental health well-being of a population. The Fit Cities conference was based on these. There's been 7 in New York with the same title, and the New York crowd asked if we could have one in London, really because of the Olympics, knowing that what had happened at the Olympic Park was hugely important in regenerating the east of London, but also the design of the park being highly accessible and encouraging physical activity and walking and cycling was really key. And so we had elements of talking and this sort of thing happening in City Hall, but we also had active walks. We took the delegates out around areas of London that have had good urban design built into them. And we also heard from Rio and almost handed the Olympic baton on. Very exciting sort of situation to find ourselves in. And it's key for the Mayor, because what the Mayor also produces is something called the London Plan, which I've got the front cover of over there. The Mayor has a role in planning in this city in that he writes the strategic guidance. He writes the guidance that the boroughs, the next layer down of local government, they actually implement when they make their planning decisions. And there is an element of health having been built into the London Plan, and it will be refreshed again when there's a new mayor in another couple of years' time. But in the meantime, we want to maximise the potential of that, and we have recently appointed Rachel Flowers, who asked the last question at the end of the morning session. And Rachel is going to be working in my team, working with the planning people to help them maximise the potential of the decisions they make to improve the health of London. And she's been welcomed with open arms, which is very exciting for us sad public health people, but it's nice that somebody appreciates us. But it'll be very exciting to see what we can bear fruit with that post. So I just wanted to say thank you. I wanted to remind you what I said at the beginning, that I think women are integral to an awful lot of that. They're especially things like the healthy schools and the healthy workplaces. They are the champions often that get that sort of initiative going. Very key to making their own communities, no matter what shape they are, be that the workplace, be that where they live, work for the people who live within them. And so we couldn't do a lot of this without the energy of the volunteers that help us to do it. And I'm very grateful to them. It's great fun, but we do need to do an awful lot more. We are very aware that we are merely scratching the surface, and it's very exciting when we have debates like this, we have conferences like this that highlight how important the urban environment is to the whole elements of the urban environment is to health, because that's what we can work on in the Mayor's office, and that's what we can influence. So we hope we'll be able to do an awful lot more. Thank you. And I'm being told I'm happy to take questions, but I don't know if we're moving on or not. Yeah? We can take questions if anyone's got any, but otherwise, if you want to get on with your macaroons.
As a non-healthcare professional,
yeah.
How can I, as an individual, contribute to London and social change?
Great. As an individual, as a non-health professional, how can an individual contribute to London? I think it's about modelling good behaviour. I think it's about not being a smoker. I think it's about getting on your bike, getting on your walking, making that the normal behaviour. It's about supporting your own local community. When you have a local school, ask the governors whether they're a healthy school or not. Ask your workplace, is it a healthy workplace? Why don't we become one? Just become that little bit of an irritant activist. Okay? Back to the macaroons.